Play. Hi, my name is Tamina Williams. I'm in NR 302 and I'm doing a respiratory and cardiac return demonstration. I'm gonna go ahead and take the camera from my cameraman for a minute to do a sweep of the room, just to let everybody know that there's no papers or anything. I'm trying to follow the rules, okay? I'm gonna hand the camera back to him. Okay, hi, how are you?
Good.
Okay, I'm gonna be your nurse today. Is it okay if we listen to your heart and lungs?
Yes.
Awesome. Okay, so I'm just gonna start off with inspection. I'm gonna start with respiratory. So I'm gonna start off with inspection. Okay, patient is alert and oriented ×4. Her skin color is appropriate to her genetic background. She's sitting upright, hands crossed, hands and feet crossed. Her expression matches her stated mood. And looking at her thorax, the transverse diameter is twice the anterior posterior diameter. Sternocostal angle is approximately 90 degrees. When I look at her back, I don't see any scoliosis. I don't see any kyphosis or lordosis, and she appears comfortable. And so I'm gonna move on to the next stage, which I'm just gonna make sure that there are no lumps or bruises or any kind of tenderness, okay? And then I'm going to move on to tactile fremitus. So when I place my hand on your back, can you please repeat the phrase blue moon?
Yes.
Okay.
Blue moon. 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 Blue moon.
Okay, so even vibrations were felt throughout. I'm gonna go ahead and move on to symmetric expansion. I'm gonna place my hands between T9 and T10 on her back. Can you go ahead and take a deep breath for me? Great, okay, so her chest expands symmetrically, which is a good thing. And so I'm gonna go ahead and percuss the lung fields. I'm gonna put this down for just a minute. So you just relax, and then you're gonna feel me tapping on your body. Okay, so resonance predominates her lung fields, and so I'm gonna go ahead and take a listen. Is it okay if I listen to your lungs?
Yes.
Can you take a deep breath each time you feel the stethoscope?
Yes.
And please let me know if it feels, or if you need me to slow down, or if you feel dizzy.
Okay.
Okay, breath sounds clear and equal bilaterally. No adventitious breath sounds. She sounds healthy. No crackles, wheezes, stridor, or rails. So I'm gonna go ahead and move to the front so I can listen to your lungs, and then we're gonna move on to your heart. Is that okay?
Yes.
Okay. So please take a deep breath each time you feel my stethoscope. Okay, just gonna listen down here. Okay, it's the same as the posterior side. Breath sounds clear and equal bilaterally. I'm gonna go ahead and move on to the cardiovascular. And I'm just gonna start by inspecting her. When I look at her neck, there's no signs of carotid artery or jugular vein distension. So I'm gonna go ahead and feel her carotid pulse one at a time. Carotid pulse is normal. It's not racing, there's no vibrations. Okay, and so now I'm just gonna go ahead. Is it okay if I palpate your chest?
Yes.
Okay. So just want to make sure that I don't feel any vibrations, any heaves or thrills. Okay. And I don't feel any of those things, so I'm gonna go ahead and move on to I'm going to listen to your heart first with the flat side, the big side of my stethoscope, and the little side. Okay, with my diaphragm and then my bell. And so I'm going to go ahead and listen one more time. Aortic. Pulmonic. Erb's point. Tricuspid. I'm going to ask you to lift your left breast for just a moment. Mitral valve. And from here, the apical impulse can be detected. I'm going to go ahead and listen for 15 seconds. Okay. I'm going to listen with my bell. Aortic. Pulmonic. Erb's point. Tricuspid. Can you lift your breast one more time for me? Thank you. Mitral valve. Okay, thank you very much. So S1 and S2 were heard at each of the heart locations. No detections of murmurs or bruits. She sounds healthy. So that concludes my video. Thank you.